Hi, everybody. I'm Crystal Haynes. Tonight on Greater Boston, Governor Maura Healey is calling on Steward Health Care to get out of Massachusetts as its financial crisis takes a toll across the state. What will that look like? And how is this all affecting patients in Steward's hospitals and beyond? Plus, more elite colleges and universities are doing away with the pandemic-era pause on their SAT requirements. What does this mean for lower-income students applying for admission? We'll discuss ahead. And finally, what's a hearing dog? A local woman who lost part of her hearing introduces us to her service pup, Kona. As Steward Healthcare's financial struggles worsen, Governor Maura Healey is sending a clear message. Get out of our state. The for-profit network is buried in debt and is behind on key payments. And Healey says that Steward hasn't been forthcoming with key financial documents that they're legally required to share with the state. That's left state leaders increasingly unsure about the future of Massachusetts healthcare as the impacts of Steward's crisis ripples out to other hospitals across the state. Joining me to discuss are Greg Wilmot, President and CEO of the East Boston Neighborhood Health Center, Tim Quigley, the Senior Vice President of Special Projects for South Shore Health, and Alan Sager, Director of the Health Reform Program at Boston University. Thank you so much for being with us.
Thank you.
Thanks for having us.
Well, I mean, Greg, we talked a little bit about this off camera in terms of the ripple effect for patients. I wonder if you can speak a little bit to that.
Wonderful. Thank you, Crystal.
Yeah.
It's really important to understand that the Massachusetts health system is a fragile ecosystem. So any significant impact to access is going to have a downstream impact on other hospitals, other access points in our system. And I think that's the major concern right now is what is the downstream effect that we're going to experience in communities of color and communities across the state, particularly around emergency room access, primary care access, specialty care access, and inpatient beds.
Do you anticipate if Steward does start closing down their facilities, you all will have to sort of pick up that patient load?
Absolutely. Just on kind of recent data, some of the Boston area Steward hospitals, in terms of emergency department visits, are probably about 45,000 emergency department visits. Where are those going to go? They're likely going to go to other area hospitals and to organizations like mine. The East Boston Neighborhood Health Center operates the only satellite emergency department facility in the state, and we will certainly see some increased volume in our ED.
Yeah. Alan, I recently watched the Boston City Council meeting on this topic, and you made a really interesting comment. You said that state officials, they are clear about what they will not do rather than what they will do. I wonder if you could explain a little bit about that.
Well, that's right. State government has said no money for Steward, for example. The real challenge is, can state government quickly pick up the tools it needs to stabilize every needed hospital, especially the Steward ones? Because too long in the past, for too long, state government has lurched from one crisis to another. And we need knowledge, we need legal power, and we need money in state government. Knowledge of which hospitals are needed where, the legal power to petition a judge to put a hospital in receivership when it's needed and on the ropes. And third, an emergency hospital stabilization fund financed by tiny assessments on hospitals themselves that will act as an insurance policy.
Tim, I'm curious about what you think the impact on patients will be.
I agree completely with what Greg had said before. I think 70% of our patients that are in hospitals today comes through the emergency department. So I think the ground zero, the biggest challenge really is the ED and that redistribution of volume that Greg talked about. I also think that the primary care issue and specialty issues all play to drive people towards the emergency department, and people arrive sicker and less well prepared with more advanced disease as opposed to going upstream. So I think South Shore, for example, in this region, We've had Quincy Hospital close and Norwood close because of a flood. So those are two Steward hospitals. We also had an unfortunate fire at Signature Brockton, so lost 200 beds in the region and a busy 60,000 visit ED there. So, and then we had Compass Medical Group close very abruptly, which really restricted access to a lot of primary care and specialty pieces. So I couldn't agree with Greg more and Dr. Sager and more in terms of having a rational approach to this. I do think that the state has been working furiously on this, but there's a lot of ground to cover in a short period of time.
I think one of the, a lot of the critics of this situation has talked about is that this was preventable. So some of this has been seen coming down the pike here. And I know, Dr. Sager, you spoke to this before, that a lot of what we're seeing now with Steward was preventable.
It was preventable. The original sale of the 6 Caritas Christi hospitals to Steward was a mistake. And I don't think then Attorney General Quigley should have approved it. I don't think she had the guarantees that were needed, but the Archdiocese was desperately anxious for understandable reasons to get out of owning hospitals. And the then Attorney General allowed the Cerberus and Steward purchase as a way of patching things together. But if you stumble from one crisis to another, you don't really fix the problem. And that's, in a way, that's crazy because healthcare spending in the country is 5 times defense spending. Massachusetts this year will see our hospitals spend $45 billion alone and $125 billion on healthcare overall. That's $18,000 per citizen. It's enough to do the job.
Yeah, that's absolutely right. You know, I want to pull up a fact or figure here from December 2023. A study from the Journal of the American Medical Association showed that private equity acquisition of hospitals on average are associated with increased hospital-acquired adverse events despite likely lower risk pool of admitted Medicare beneficiaries, suggesting that poor quality of inpatient care. I'm curious, Greg, when we talk about, you know, this impending closure and what that domino effect we've been talking about, what that looks like, is there a concern that, you know, you're going to hit capacity and not be able to treat patients the way you want to?
It's a great question. It is a fragile system. Mm-hmm. So we know that any change in access is going to have an impact. I think the hope is with time and intentionality, we can plan for where those impacts will likely be felt and be able to take measures to intervene. That might come in the form of how do we expand primary care? How do we invest in community health centers? How do we expand capacity at area hospitals? So there are a number of ways for us to get ahead of this kind of impacting patients. But I do think that that's the concern, is if we're not able to really get in front of this early enough, we're going to start to see impacts to patients and ultimately, particularly for communities like those served by the East Boston Neighborhood Health Center, largely Black and brown patients. Mm-hmm. The equity issues that we've been concerned about, that we've been working so hard to close, those will over time be further exacerbated. So I think with a planned approach, we have a great opportunity to course correct.
Yeah. Tim, you mentioned all of the hospitals and healthcare facilities closed in your region. How do you then plan for another potential situation, another hospital system closing down?
So we've worked with the state to have those convening cards. They've acted as a convener to really get people around the table, just like Greg said, with the community health centers and the other providers in the market. And it's a ecosystem. I love the term that he used because it's not just the hospital side, it's primary care access, there's urgent care pieces, there's specialty care. All those pieces need to be really considered. So I do think you have to look at a more central approach and what's rational, for allocation of resources and try to figure out what's the right way to allocate resources to get the best possible outcome for patients with OB programs, pediatric programs, specialty surgical programs. There's just a lot of moving parts. It's a complex system. The ecosystem metaphor is a great one. So I do think you really have to sit with data and plan this out. And I couldn't agree more with Dr. Sager. We're spending as a country the money, but not getting the outcomes that investment would normally return. And I think that there's a major discussion about choice and networks, and how our system has evolved right now is not it's reactive and not rationally planned out. So I do think private equity, your point earlier, is a great one. And what is the role of private equity and stuff? Return on investment is how that fits with caring for patients and meeting where they're at is a really interesting social conversation and a social justice conversation to have, frankly.
Yeah, and Dr. Sager, I want you to give you a second to respond, but I'm also thoughtful about when we're using these terms from the business world, when talking about people who may have chronic illnesses or people who were set up from the beginning to not walk into the best health and need the healthcare system, in talking about return investments and things like that and having for-profit hospitals, it seems sort of antithetical to the actual practice of medicine and of operating hospitals. So Dr. Sager, I will ask you, as we look forward to whatever the plan that Steward Health is actually going to tell us about. We know the governor wants them out completely. What do we need to be doing as a state in terms of learning our lesson about what happened here with Steward hospitals?
The state has to stop sleepwalking from one crisis to another. For decades, we've been, some people have seduced state government into thinking that all you need is watchful waiting. But if you're awake for hour after hour, you fall asleep. So state government has to pay attention. It has to recognize that there is no functioning free market in healthcare. So competition and profits are not legitimate. But when you don't have a functioning free market or competent state government, you have anarchy. And that's how we manage to spend so much and have what's been called on our program today a fragile system. We talk much more than we act, and state government needs to stop ignoring the problem and then just patching together quick solutions that aren't durable, but instead step back and figure out how we take care of 7 million people and recognize this is the easiest problem, not easy, but easier than any of the others, the easiest problem to fix because it's the only one on which we already spend enough money.
Certainly lots to break down here. Greg Wilmot, Tim Quigley, and Alan Sager. Thank you so much for your time. I really appreciate it.
Thank you.
Thank you for having us.
Thank you.
Next up, standardized testing is making a comeback in college admissions. Yale is reversing a pandemic-era policy that did away with SAT and ACT requirements for applicants, joining Dartmouth, MIT, and several other top colleges. The universities say that the removal of the testing requirements put low-income students at a disadvantage, but critics say the opposite is true. GBH News higher education managing editor and correspondent Kirk Carapezza has been covering this story closely. He joins me to discuss, along with Natasha Warikoo, a professor of sociology at Tufts University, which, I should note, has extended its testing optional policy since 2026. Welcome to you both.
Good to be here.
Thank you for having me. Well, let me ask you this, Kirk, we could come out and ask this question: does standardized testing at admissions help or hurt low-income students? We were talking about this a little bit before we started taping.
Yeah, it depends who you ask, right? So these policies will affect prospective students for the class of 2029. And these colleges, I think it's important to step back and to look at why these schools went test optional first, right? It was during COVID. You couldn't physically take the test. So this is a way to level the playing field. Also, for context, this is around the time that the Supreme Court ruled against Harvard and the University of North Carolina, and said that they can't consider race in admissions, right? So the colleges at first said, these tests can signal a family's income. High-income families tend to have higher test scores. But the schools, Dartmouth, now Yale, and there's a study out of Harvard that found high scores from less advantaged students can signal high potential in college.
And Natasha, you write extensively on this topic in terms of standardized testing and low-income students and the effects basically in the system.
Yeah, I mean, I think this issue is incredibly complicated, and I think, anyone who says, like, definitely we need the test or definitely absolutely no test, I'm a little skeptical. And I say this because when you look at the data, it points in all kinds of directions. So it's true that, at some colleges that they've looked at their data and there are some low-income students who didn't give their test scores that may have gotten them in. On the other hand, we also know that when there is a testing requirement and a student looks at that band and says, oh, well, the 25th to 75th percentile are these scores that are way beyond what I achieved, forget it, I'm not even going to apply. I think that also happens. So which of those, they balance each other out, and we don't really know how students are going to behave when a policy changes. And so I think it's important to keep that in mind, and that, that there is no perfect solution. MIT went back to the test. Caltech went, Caltech, like the MIT of the West, went in the opposite direction, and they actually said, we are not going to look at test scores. Even if you submit it, we will not look at it, because we have found, they said that in their data, they found very little difference in terms of first-year test grades in between people who submitted and who didn't, and by subsequent years, those students did just as well. So, I really think, anyone who says there's a simple solution to this, I think, is missing part of the story.
And there's a spectrum, right? There's test optional, and then there's test blind, like you described in California. But then there's also test flexible, which is actually what Yale did, right? So they're requiring students to submit their scores, but you can also submit AP exams instead. Now, critics will say that still benefits high-income families because who tends to take AP exams? Right. It's rich families, and in our country, that tends to be white and Asian people.
And they have the ability to do the pre-test, and they can afford the tutors.
Hire tutors,
like
There's all kinds of advantages that are baked into the system.
Yeah, well, how does it affect then, I guess, the diversity of the school population? Because that's something that, has been top of mind to a lot of universities.
And we're talking about two things, right? We're talking about economic diversity, and the schools are really the schools that are going back to requiring these test scores are saying that this will lead to greater economic diversity on campuses that lack it. When it comes to racial diversity, I think it's up in the air. And like Natasha pointed out, if the students are less likely to apply because there's a testing requirement, then the applicant pool itself will be less diverse.
Yeah, will you speak more on that in terms of how could this affect, the diversity of the student population, let's say, if we're going by race or even by income?
Yeah, I think the bottom line is we don't know, and that's the reality, right? We don't know how this is, because we don't know how this is going to affect student behavior, right? So in an ideal world, yes, students would have perfect information. Colleges would tell them exactly, if you live in these particular neighborhoods with this median household income, you need this score to be taken seriously. But, it's much more holistic, and, they're worried about being sued because of their recent affirmative action decision. So there's a lot of kind of opacity. And I think, but I think this idea that we can kind of get it right. And I think the other thing to think about is that, when the colleges are saying, well, we want to know which of those low-income students to admit and the SAT will help us, my answer to that is admit both of them. Admit all of them, because these colleges have done a pretty poor job of admitting low-income students, poor students, underrepresented minorities, even middle-class students. And so, the reality is that they have, they're spending so much per pupil, and they have the resources that, even for that student who maybe has a low SAT score, with the right resources, they can be brought up to speed as well. And so I think we need to be expanding opportunity and thinking about ways to do that, not kind of differentiating and making these micro decisions based on the SAT.
Yeah, well, I mean, my question is, should they be worried about lawsuits after some of these provisions start slowly coming,
Perhaps. I mean, we sat in on when we covered the trial here in Boston in the Harvard case and affirmative action. I mean, they pointed to the test scores, saying like, oh, look, these Asian students who scored, on average this on the SAT, they were held to a different standard. So by dropping that qualitative measure, it might prevent lawsuits. But Yale, the admissions director at Yale said, threats of lawsuit should not change how we operate.
Do you see this as just one thing that we could see in higher ed in terms of changes post-COVID? Like, these are some of the things that we put in place as a triage method during COVID. Do we see other things sort of rolling away from that?
I think so. I think it's important to keep in mind that, we have, these are just 4 very selective colleges that we're talking about, right? 80% of colleges in this country are still test optional, right? That's 1,800 schools. So the admissions process has become so convoluted, right? And there's so little transparency. And I think the students that I interview and their school counselors are just really confused about what to do, right? Should you submit test scores? Should you not? But I think it's important to keep in mind that there are so many schools, and most of them would love to be on your short list, right? These schools we love to talk about the highly selective or the highly rejective colleges, but most schools are admitting more than half of the students who apply.
Natasha, do you think that this is going to impact the way that families choose colleges, where they'll say, great, there's no test requirement here, we're going to apply there, versus having to go through this process again that maybe previous generations really, at least myself, had PTSD from? Right? Like,
you didn't enjoy it?
No.
I don't think anybody enjoys it. I mean, I think it will, when there are differences in terms of what colleges are looking at, it will affect people. Someone who's a good test taker will be like, oh, well, that might advantage me. And someone who's not a great test taker will be like, you know what, I won't apply to Dartmouth. I won't apply to Yale. I think that's okay. I think we need to stop worrying about, whether, a student doesn't apply to Yale. If that student is a high-achieving student, okay, they'll apply to Harvard or they'll apply to Tufts. It's not going to make a whole lot of difference. I think we really need to focus on the reality that there are so many wonderful and amazing and aspirational young people in this country, and they all deserve an excellent education at a place that is welcoming to them, and that, if they have not had all of the educational opportunities that some of their peers had, that their college is going to help them get up to speed. And I think that's what we need to be focusing on, and not, SAT, no SAT, essay, all of these things can be gamed and advantages some people and disadvantages others. So, I kind of think, let's see what happens. Colleges are going to do different things. Families are going to make different choices, and that's all okay.
And there's so much focus on getting into college, and there's not much focus on what do you get out of it.
Yeah.
Right? And all the surveys show in this moment when the American public is so skeptical of higher education and is questioning the value of these degrees. There's a great Gallup survey that came out a number of years ago, but it basically said that those alumni who said college was worth it shared 2 things in common. One, they worked on a project for more than a semester, and 2, they had at least one professor, just one, who they think cared about them, and that's it. That's the Venn diagram. If you have those 2 things, then you had a good college experience.
It's interesting to me because sometimes this test, or most of the time, this test is considered the barometer of how good of a high school education you got, when in the end, it doesn't necessarily reflect that.
Yeah. It reflects so many things. Are you a good test taker? What do you do under pressure? How, these particular...
You mentioned about gaming.
Right.
I mean,
can you memorize certain words?
Did you have access to certain tutoring? I mean, and so it's not... But there is no perfect measure. I think we should get away from this idea that, okay, well, the SAT is flawed, but the essay is better. The essay has its own, issues or extracurriculars. And so we have to kind of think about, allow young people to kind of showcase whatever they're good at, let them, submit that. So, I think in the end, we'll have to see what happens, and I think a lot of people are watching closely. This is the first post-affirmative action cohort that's going to be admitted. I'm going to be looking really closely to see, how are these colleges doing? Are we able to continue to provide access, access in terms of underrepresented minorities on these campuses? And then, think about the SAT after that as well.
Yeah, absolutely. Well, this is certainly top of mind for lots of folks, because I know a lot of my friends, they had their kids tour during spring break that just wrapped up. So here we go. All right, Kirk, Carapezza, and Natasha Warikoo, thank you so much for being with us. And finally tonight, Kate Weaver lost much of her hearing. She turned to a service dog to bridge the gap between the hearing world and the deaf world. Kate told GBH News getting matched with a hearing dog named Kona really changed her life.
This wasn't just, to me, a dog. He takes the silence away. About 10, 12 years ago, I woke up one morning and had lost the frequency in my ear for speech. Thought I had a cold, went to the doctor and they tested and said, no, this line of frequency is just gone. Go get tomatoes this way. The biggest thing I noticed is just conversation, socialization, going to restaurants, even going to the grocery store, the mall. Anytime I had to interact with people, I have to really focus, look at their whole face. It's very embarrassing when someone tries to talk to you and you have to keep saying, what? What? And you're like this, what? People either say, oh, never mind, or it's okay. And so eventually that really wears. It really makes you start to feel kind of less than, I guess. I already wear a hearing aid, and I was trying to think about, well, what would be the next thing?
Oh, you do signs?
Yeah.
Oh.
Nice to see you. You too.
The process to train a hearing dog takes, a little bit under 2 years. We're doing socialization with them, so introducing them to all different novel things, like strange body language or objects, making sure, they can walk on all different types of surfaces.
Good girl.
So you'll start by introducing the sound to the dog. They'll run over to the sound and we'll give them lots of praise and reward. So that's with physical pets, verbal, or giving them treats. And then we'll advance it to having them go back to a handler. It's amazing to see the dogs do the things that we train them to do in action. And it's amazing to hear from our clients the stories and how the dog has impacted their life.
Carrot time, right? In any environment that I'm in, he's scanning the environment, I'm scanning him. So it's a partnership. He brings an awareness of my environment that disappeared.
It costs needs about $45,000 to breed, raise, and train a service dog. Clients are asked to fundraise $8,000 as a donation to the organization, which is currently taking applications to match people with hearing dogs. Well, that's it for tonight, but come back tomorrow where I'll talk with the state rep behind a new bill that would add financial literacy classes to public schools in Massachusetts. That and more tomorrow at 7. Thank you so much for watching. I'm Crystal Haynes. Good night.
On Master